Hey, Alpha Nurses, I'm Nurse Sandra from alphanurseguide.com. This is NCLEX PN Review Lesson 37, Nursing Priority Questions. You can get my notes on Etsy. Be sure to follow my store to get any updates on new notes. You can follow me on Facebook, Instagram, and TikTok to get any updates. All links are in the description. Without the wait, let's get started.
Question 1. A mother calls a neighborhood nurse and tells the nurse that her 3-year-old child has just ingested liquid furniture polish. Which action should the nurse instruct the mother to take first? A. Induce vomiting. B. Call an ambulance. C. Call the poison control center. D. Bring the child to the emergency department. The correct answer is C. Call the poison control center. Rationale: if a poisoning occurs, the poison control center should be contacted immediately. Vomiting should not be induced without instructions to do so if the victim is unconscious or the substance ingested is a strong corrosive or petroleum product. Bringing the child to the emergency department or calling an ambulance would not be the initial action because this would delay treatment. The poison control center may advise the mother to bring the child to the emergency department. If this is the case, the mother should call an ambulance. Question 2. The nurse is assisting with caring for a client with Abruptio placenta. While caring for the client, the nurse notes that the client begins to develop signs of shock. The nurse should take which action first? A. Monitor the urinary output. B. Monitor the maternal pulse. C. Turn the client onto her side. D. Monitor the maternal blood pressure. The correct answer is C. Turn the client onto her side. Rationale: with a pregnant client who is in shock, the nurse would want to increase perfusion to the placenta. A simple way to do this that requires no equipment is to turn the mother on her side. This would increase blood flow to the placenta by relieving pressure from the gravid uterus on the great vessels. The nurse would immediately contact the healthcare provider. The other options would follow quickly. Question 3. A woman in active labor has contractions every 2 to 3 minutes that last for 45 seconds. The fetal heart rate between contractions is 100 beats per minute. On the basis of these findings, which is the priority nursing action? A. Monitor the maternal vital signs. B. Notify the health care provider immediately. C. Continue monitoring labor and the fetal heart rate. D. Encourage relaxation and breathing techniques between contractions. The correct answer is B. Notify the health care provider immediately. Rationale: fetal bradycardia between contractions may indicate the need for immediate medical management. The nurse would immediately contact the health care provider. Options A, C, and D will delay necessary and immediate interventions. Question 4. The nurse is caring for a postpartum client with a diagnosis of thrombophlebitis. The client suddenly complains of chest pain and dyspnea. The nurse should initially check which item? A. Vital signs. B. Fundal height. C. Presence of calf pain. D. Level of consciousness. The correct answer is A. Vital signs. Rationale: pulmonary embolism is a complication of thrombophlebitis. Changes in the vital signs are one of the first things to occur with pulmonary embolism because pulmonary blood flow is compromised. Fundal height is unrelated to the subject of the question. Calf pain is an indicator of thrombophlebitis. Level of consciousness may change as the condition worsens. Worsening would indicate hypoxia. Question 5. The nurse suspects that the client has a pulmonary embolism. Which is the most important nursing action? A. Monitor the vital signs. B. Elevate the head of the bed. C. Increase the intravenous flow rate. D. Administer oxygen by face mask as prescribed. The correct answer is D. Administer oxygen by face mask as prescribed. Rationale: because pulmonary circulation is compromised in the presence of an embolus. Cardiorespiratory support is initiated by oxygen administration. Options A and B may be components of the plan of care, but they are not the most important actions. The nurse would not increase the intravenous rate without a prescription from the health care provider. Question 6. The nurse notes that the 4-hour postpartum client has cool, clammy skin, and that she is restless and excessively thirsty. The nurse immediately notifies the health care provider and then performs which action? A. Checks the vital signs. B. Begins fundal massage. C. Encourages ambulation. D. Encourages the client to drink fluids. The correct answer is A. Checks the vital signs. Rationale: symptoms of hypovolemia include cool, clammy, and pale skin, feelings of anxiety and restlessness and thirst. The nurse would check the vital signs. The nurse would not ambulate the client or encourage fluids until specific prescriptions are given to do so. There is no information in the question to indicate the need for fundal massage.
That's all I have for this video. Please like, share, let me know if you have any questions. If not, I'll see you in the next video. Thanks for watching.